In 2022, NHS Southwest created a £2.1 million community investment fund, which provided additional funds to support community investment. Each system received around £300,000 to strengthen relationship with local voluntary organisations and community groups. This short video shows just some of the ways our Dorset partners invested in local projects.
A few months ago, a few members of the community had an idea. We'd heard about waste food at the supermarket, and we had an idea that maybe we could bring that waste food to our community in the village of Wimfrith Newburgh.
This is a pop-up larder, so the emphasis is on affordable food, so bringing affordable food particularly to the more rural areas of Dorset, where perhaps in this community, for example, there isn't a bus that would allow people to get into Dorchester. It's not easy for some people to be able to get somewhere where they can get food. And in the more rural areas, there aren't the level of services, food banks for example, those sort of things, available to them. So the whole emphasis is affordable food, but being brought to the community through a pop-up larder, which is a mobile refrigerated van.
Additional things that it brings to the community, not only the availability of food, for which they do pay a subscription, of course. You know, it isn't just free food, they are paying a small subscription, but generally they're very happy with what they get. But I think I've only just realised this morning, talking to people here, that we just don't have facilities for fresh food unless we drive to Poole or Dorchester, which not everyone can do. So by bringing fresh food to the community, that's got to be helping. One lady said to me she waits to see what she gets at the fair share delivery, and then she plans her recipes for the week, and some weeks she can live on what she gets from fair share. So that is amazing and such a help to those individuals.
It's essential for local communities, you know, that as part of those communities there is an idyllic feel for Dorset and those local villages, but there are lots of people within those villages that do need support and help, and that's one of the reasons why this is such an important project for Dorset.
Every penny helps when you're on a state pension. It's very useful, and I'm doing my neighbour as well, Mary, because she's not feeling too well today, so it all helps in the community. And of course the main thing is supermarket food waste. Obviously they waste too much food, especially the fresh veg, keeping their shelves full, looking good, so it works for everyone.
Apart from the food, which is lovely, and I'm very pleased about that, and because I'm sort of housebound now, I can't get out, it's just nice to see the local people again, and just have a chat, and so I think it's a marvellous idea, and I hope it continues.
We Create is a charity that runs this building, which is called the Old Schoolhouse, and within this building we run lots of community work. We're mainly a creative business, creative charity, and a lot of our things is all about bringing people together and doing creative things together and bringing, you know, people to get to know each other and building community. We run a few different groups. The Monday group is a group that is brought together to just bring community to get to know each other. And, you know, like after COVID, I think isolation was something that, you know, everybody found it really hard, and the groups are just drop-in groups that anybody can come. But we also do something, you know, we do some creative things together just to give somebody something to do while they're talking, and then we always have a shared lunch together, and just bringing people together really. The ladies group, they just are incredible. They come back every week. They've said that, you know, they've made friends, they've built connections, and they feel safe, and they think it's a really safe and welcoming space.
Yes, I like the group. I really enjoy the group. It's fantastic because I learn new projects. Every project is different. Embroidered, macrame, crochet, felting. It's fantastic for me and keep my mind busy. I really enjoy this time.
NHS funding that we received has really made the group sustainable, and also a really important part of those groups is coming together and sharing a meal, and that's what it allowed us to do, is that because people are here for longer, you share over food, you have conversation over food, because you know it's just about sharing that. So I think the money that we've got has enabled us to do that in a few of the different groups, and it's been really important.
Safe and Sound Dorset was set up 6 years ago. Before that we'd been doing outreach on the streets to women on a Friday night, but we wanted to have sessions for women during the week, so we set it up as a charity, and now we run 7 sessions during the week for women who are isolated or at risk in the community, and those sessions are in a variety of places in the community. Sessions are normally drop-in sessions. It usually covers eating and drinking together as a group, and we also do creative activities, so we do all sorts of drawing, painting, craft work. So we have specialist speakers coming in to talk about different things. We have specific groups like the housing group, which with the housing group we have a shelter rep coming in to do, so we can do referrals straight to shelter for people with housing issues. We also do universal credit help, and we have the CAB coming in to talk to people, giving them advice about different issues in life. So we do some specialist sessions like that, but on the whole it's meeting together, having lunch together normally, or refreshments, some sort of refreshments, and then we do a craft together.
It just means being part of the community really, and get to meet friends that we've made, gets us out the house, gives you a sense of purpose, you know, to get up in the morning and we've got somewhere to go, just have a chat.
Yeah, it's like you've got your own little group, you've got your own friends around you, you can wake up in the morning and just know, oh yeah, good, I'm going to catch up with all of them again, have a chat. It's good, there's all sorts of women, all different stories, it's been a great thing, yeah. It's really lifted my life, I tell you.
Some of the women that live on their own, it's particularly important for them to come in and actually join with a group, especially to eat together. I mean, eating together is amazing. When you live on your own and you don't have a meal with other people, it's lovely to come in and sit around a table and eat together. And it's been particularly obvious since we opened the cafe, the coffee lounge, how important it is, not just for our women, but for a lot of other people as well. You know, we have regular people coming into the well who are very isolated and on their own, and it's become their family.
It means the world to me, because I've lived here for quite a long time and I could walk around and not see anybody that I knew, whereas when I come to Safe and Sound I've got to know a whole load of wonderful ladies, and without it I would just stay at home and be isolated and not speak to anybody. Whereas here I could do my art and craft at home, but then I'm just doing it on my own. Whereas here I can come here and we interact, and it means I get a lot more social stimulus. You know, plus it's a great place that you can bring your friends to, and it's a normal thing to do instead of being tucked away in some sort of special group. So it makes you feel more a part of the community.
I wouldn't know where else to go, to be honest. You know, there are different groups of different people, but I think this is a very mixed bag, so it's quite good.
Yeah, and it's about that company. It's not directed at anything in particular, so you can come with whatever your issues are, and you've got time just to be yourself and just be with friends. If I hadn't come here, I'd definitely be a lot more lonely and a lot more depressed. Really, I'd be alone.
I come Wednesday and Fridays and sometimes Saturdays. We do lots of activities, we go out, we do loads of stuff here when I come to the club. Sometimes we go out, we have picnics in the summer. We go out on trips, which is really good. Yeah, I enjoy it, yeah, very much. It's very good.
We are a social, leisure and learning community for adults with learning disabilities from across the conurbation. People can just come in and meet and make friends, but we also offer some structured activities. We run lots of stuff about health, relationships. We do regular Zumba sessions. We have people in to do workshops. For instance, today we've got somebody talking about the Bill of Rights. We might have animal encounters. We do off-site social events. It's a really busy, something for everyone kind of club. Historically, we've only ever run on a Thursday and Friday. And when we had the opportunity of some extra money, we were very aware that quite a few of our members don't have a lot of support. They're really struggling with the cost of living crisis. You know, they didn't have anywhere to go, and particularly in the colder months, they were really struggling on lots of levels. I think post-COVID, I think our members were particularly hard hit, and I think most of them are not yet back to where they were. So we felt it really important to support them, but also for us it was a way to trial expand into a third day. So for 2 months we ran on a Wednesday that was free to anyone to come along. We offered a 2-course hot meal, and yeah, so it was a warm space, you know, somewhere to meet and make friends, and it was an opportunity to attract new people to the club. One of the things I'm proudest of is that after club, people will go into Winton with a couple of their mates for coffee. And you know, that's a really small thing that any of us would take for granted, but for these guys, they've never had that before.
The Winter Crisis Fund was there to help with some of the most deprived communities within Bournemouth, Christchurch and Poole. Namely, from our point of view, it was kind of Kinton, West Howe and Boscombe. From looking at our data, they are always areas which we had heavy engagement from, and it's areas which we know there's a lot of voluntary sector engagement from the likes of Henry Brown Centre in West Howe. So we know it's an area which could have been really well connected and really well to distribute the funds and the supermarket vouchers that we offered there. But with the Winter Crisis Support, the emphasis is very much on helping those that are suffering from kind of a health condition, and that's where we kind of allude to probably the most deprived areas, because we have a lot of kind of information on those areas showing that they are suffering kind of from the greatest kind of long-term health or mental health conditions. And it's really important to differentiate that from a household support scheme, as that was kind of generally available to all residents which are available, which kind of meet the financial test for. Whereas kind of with the NHS kind of Winter Crisis Fund, that was specifically aimed at those with a health condition and kind of making sure there's relief there. As we say, just like with the financial pressure, that does translate into a health crisis in itself. Just thinking about rent arrears, or kind of maybe you're just falling behind on the catalogue, it really does add that financial pressure, and that exacerbates it in those with kind of a health condition or pre-existing condition. It either gave people kind of £200 in supermarket vouchers, or there's an option for energy vouchers. We had about 224 people come to us for supermarket vouchers and a further 27 for energy vouchers. So we know that coming from kind of the COVID kind of pandemic, it had a lot of financial implications. Of course, going into a cost of living crisis, it exacerbated health conditions, a lot of financial pressure on households. And I think, you know, out of all the people that we served with the winter crisis, 67% said that they had a health condition. Within that, 37% said they had a mental health condition, which of course with financial pressure exacerbates the issue. So therefore, just providing that £200 of relief, whether it by supermarkets or energy vouchers, can provide a little stop by, just a little bit of relief towards the financial pressure. I mean, we've had a few people just reach out, just saying how thankful they are and grateful for it, and you know, it's really great to see. And we know just kind of when reading those emails of just saying thank you for the vouchers, you can see almost the relief that comes with that, which is really great to see.